Mental Health Act. The Mental Health Act is the law governing the compulsory treatment of certain people who have mental disorder. This means that a person can be detained, also known as sectioned, under the Mental Health Act, 1983, and be treated without their agreement. People detained under the Mental Health Act need urgent treatment for a mental health disorder, and are at risk of harm to themselves or others. Who decides that someone should be detained? 1. In emergencies. An emergency is when someone seems to be at serious risk of harming themselves or others. Police have powers to enter your home, if need be by force, under a Section 135 warrant. You may then be taken to a place of safety for an assessment by an approved mental health professional and a doctor. You can be kept there until the assessment is completed, for up to 24 hours. If you're already in hospital, certain nurses can stop you from leaving under Section 54 until the doctor in charge of your care or treatment, or their nominated deputy, can make a decision about whether to detain you there under Section 52. Section 54 gives nurses the ability to detain someone in hospital for up to 6 hours. Section 52 gives doctors the ability to detain someone in hospital for up to 72 hours, during which time you should receive an assessment that decides if further detention under the Mental Health Act is necessary. 2. Non-emergencies. In most non-emergency cases, family members, a GP, carer or other professionals may voice concerns about your mental health. They should discuss this with you, and together you should make a decision about what help you may need, such as making an appointment with your GP to discuss further options. The length of time you could be detained for depends on the type of mental health condition you have, and your personal circumstances at the time. How long will patient be detained? Up to 28 days under Section 2 of the Mental Health Act, up to 6 months under Section 3 of the Mental Health Act, with further renewals. What does the term being sectioned mean? The Mental Health Act is structured in many sections. If someone says, "You're being sectioned under the Mental Health Act," they mean you're detained according to a particular section of the Mental Health Act. Consent to treatment. If you're held under the Mental Health Act, you can be treated against your will. This is because it's felt you do not have sufficient capacity to make an informed decision about your treatment at the time. What is Section 17 leave? This means that while detained under the Mental Health Act, you may be able to leave the hospital if authorized by the doctor or clinician in charge of your care, also known as the responsible clinician. This leave is often referred to as Section 17 leave, as it's Section 17 of the Mental Health Act that allows this leave. The responsible clinician in charge of your care can place conditions on the leave, such as where you should stay while away from the hospital, and whether this will be for a fixed period of time. Trial questions. 1. Which of the following agencies are required to section someone at home who is at risk to others? A. Police officer, doctor and magistrate to issue a warrant. Next of kin, social worker. Relative and a police officer. Magistrate, police and paramedic. 2. What is Section 17 leave under Mental Health Act? A. A period of leave from the hospital for the patient. A period of detention under Mental Health Act. A period of leave from treatment. None of the above. 3. Who can detain a patient under Mental Health Act? A. Magistrate. Patient's family member. A police officer. A doctor or approved mental health professional. Kindly type your answers at the comment section for feedback. Subscribe to the channel for more videos.